Today I wanted to show you something about what I have been doing up until this point. Many things, of course, but something that might be of interest to you is this study that's been published up on the wall up here. This is a study that was completed several years ago now by myself in conjunction with some other healthcare professionals, some neurologists in and around the Sydney area, where what we did was we wanted to see if we could find a medication-free way to manage the pain of headache. So we invited 40 people with chronic headache, whether it was cluster headache, migraine headache, or tension type headache, and regardless of age or gender or the type of pain relief they usually used, we invited all of them, one at a time, to come and have 3 sessions with myself. And we measured beforehand those things. Well, we measured the type of medication they were using, and we measured how often they took the medication, and we measured their experience of pain, their current experience of pain. And at each of the 3 sessions, we actively intervened with a psychological therapy using biofeedback. So the psychological therapy part was to talk to people to help them to understand their nervous system and the stress response a little more clearly based on what we know from science. And also to take people through a mindfulness exercise of observing breath and deliberately noticing and relaxing muscle tension, a process of progressive muscle relaxation. And then people were instructed to watch the screen. It was just a normal laptop screen, while we had some sensors on their shoulders, on trapezius here, which is where a lot of referred headache pain starts. And also we did a breathing monitor around their chest, around the diaphragm, to measure the breathing rate. We measured beforehand whether people had clinically significant scores on a depression, anxiety, and stress scale. And people were invited to practice the relaxation of their muscles and the breathing exercises at home in between the sessions. After just 3 sessions, these are the results we had. I'll show you the poster, because this poster was presented at the Australian and New Zealand Association for Neurologists and was very well received. It was later published in the Journal of Clinical Neuroscience. Can you see there what we managed to achieve? We've got such a big drop in our scores that it just looks like a vertical line going straight down. Depression scores dropped. Our experience of pain in the green here went from 75.7 down to 38.1. People's experience of analgesic use went from 16, that's tablets per week, to 5.6 tablets per week. And people's experience of depression went from 35 down to 25 after 3 sessions. If you think this might be something that you would like to learn more about, please do reach out. We're here to help and offer practical, evidence-based solutions to real-life problems that can get in the way of you enjoying your quality of life. I'm Ellie Mackay from Ellie Mackay Psychology.